White letters and a microphone appear atop gray clouds and a yellow sun. Sunstorm stories. Gilberto Spencer appears on screen. Gilberto describes himself as a Latino neurodivergent gay man.
During my home visit, the doctor wasn't really concerned about me having COVID. He was really concerned about suspected pneumonia, and that's where he kept all of his attention. I did ask if I should get tested again for COVID, and what the doctor explained is that over 5 days had gone at the time, and he said that yes, during the first days of getting the symptoms, it is important to test. But as it had been over 5 days, and because I was isolated and didn't have contact with anybody, he said that he wasn't concerned about COVID at the time, and he also said that there was no point for me to test again at that point. When it comes to suggestions that I can think of for healthcare professionals and how they can improve um, their their treatment or their services for neurodivergence, it's that I think they have to be very. I would like for them to be aware that looking and sounding exactly like everybody else doesn't mean that we are indeed like everybody else. When it comes to advocacy strategies that I might have learned from COVID, I learned that it is really important, and how important it is for all of us to have a support network, because these 2 times that I got COVID that I shared with you, that I mentioned, I was entirely by myself. Yes, on the first time I had a companion, uh, but it was a pet. It wasn't another person, and I think it's really important to have a support network that can keep an eye on yourself. Maybe you cannot be next to each other because of the pandemic, but I think it's really important to not be completely isolated and to have someone who's keeping an eye on yourself. And since the condition that I have is FASD or FSD, what I would like to point out is that because of the pandemic, a lot of people turn into alcohol to cope with the high levels of anxiety and stress, and because all of the uncertainty that was at the beginning during the pandemic. And I would like for people to know how damaging it can be for an unborn child.
Four logos appear on screen. This initiative was brought to you by the National Disability Rights Network, Foundations for Divergent Minds, the Johns Hopkins Disability Health Research Center, and funded by the With Foundation. For more information or to share your story for future editions of this project, visit us at ndrn.org.